Welcome to another CEO Wisdom Pod with Marissa Fayer with us today. She's CEO and founder at Her Health EQ. We're going to talk about healthcare, medtech, health equity, women's health, and investing in health today. This podcast is brought to you by podpire.com. That's my podcasting agency. If you want to start, scale, or be invited to a podcast, you can go to podpire.com or just Google my name, Charles Cormier. Marissa, welcome to the pod. Tell me a bit more about yourself and about Her Health EQ.
Thanks so much for having me. So for me, I'm a 23, almost 24-year-old medtech executive. I've been in healthcare my whole career, engineer by background. I thought I was going into space, and then I got recruited into the healthcare industry and kind of never left. I helped a lot of companies for 15 years develop new products. I was doing mergers and acquisitions. I was doing a lot of integration work with new products and cost savings and things like that. I moved to Latin America. I moved to Canada. I moved to everywhere around California and the US. And after about 15 years, got a little burnt out, left corporate life, started a very successful consulting firm. And built that up for about 8-9 years. At the same time, I started Her Health EQ, which is a global nonprofit focused on women's health in developing countries. And what we do is we make sure that women have access to quality medical care and quality medical equipment. And this came out of my work at corporate. And so I saw that there was a need when, the old mammography systems for which are used for screening for breast cancer were returned for the new versions and eventually thrown in the trash. And for a piece of equipment that's $250,000 or more, I thought that was a waste of money and really not great for the environment as well. And that there's a lot of equipment that's not accessible for developing countries, and especially for women. And so started facilitating the donations and deployment of equipment. And, Her Health EQ has been in existence since 2016. And we've impacted 33,000 women's lives so far. We're on a trajectory to impact 1 million women by the end of 2026. And really growing and scaling at this point. But we really kind of solved this gap of like, hey, we've upgraded our equipment. What do we do with the old equipment? Oh, well, you want a tax deduction. You want to feel good. You want your ESG and DEI metrics checked. And, you want some publicity. Well, you partner with Her Health EQ and we deploy the equipment around the world. So that's what we're about. And that's my background.
Pretty cool background. Will you ever come back to space eventually?
Well, I have my tickets already. So, I'm waiting for my number to be called. So we'll see. I definitely, I'm planning, I'm on the list. I'm ready to go. So
what list exactly?
All of the commercial space flight agencies all have their lists, and, my deposits are in, and I'm waiting for them to become a little bit more stable, a little less experimental, and hopefully, I don't know, it becomes a big thing, and I get to go to space. That's the hope.
How much do you have to deposit to be on these?
So it depends. Sometimes as little as, $500 to $1,000, and some of the other ones are, $10,000 as a deposit. So
what about your own space company?
Eventually. Oh yeah, that's too much money that has to be raised, and since most people don't invest in women, it's a really hard challenge at this point. Not really my background. I think I'll perpetuate healthcare in space. I think that's a better use of my time.
Right. Then why did you move from corporate world to the entrepreneurship world?
So it was. Some of it was my choice, some of it wasn't. I was out of country. I wanted to come back to the US. So technically they had to, for legal reasons, had to hold a position for me, but that position was 4 promotions ago. So I obviously did not want to go back to that. And then, 15 years in corporate, it's exhausting. And I was always fighting and I didn't know what that was. And apparently it's because I'm an entrepreneur. When I was younger, entrepreneurship wasn't the thing that it is now. And now it's popular. And so I realized I was fighting because I didn't like the way things were done. I didn't like the systems. I didn't like how difficult it was. It didn't, I didn't, who knows? I didn't want somebody to tell me what to do. And so what happened was, I think that I was an entrepreneur, kind of always. I was always creating like mini projects when I was in corporate, and I was always doing like that entrepreneurship, but nobody knew what that was called. So that's, I guess it was always in me, but we didn't know, and nobody knew what it was called. And so here I am. I was labeled difficult. I mean, I think that's the trait of an entrepreneur. Just keep going. Finding problems, fixing them, right? If we find problems, we fix them. That's what happens.
Right. The label difficult is quite funny there. Your consulting firm, why was it so successful?
Because I was in corporate before. And I also wasn't I wasn't a Deloitte. I wasn't a big company. So I was able to kind of slot into these areas where I'm a doer. Like, I'll get the job done. I'm not going to tell you how to do it. Like, there's plenty of companies that can just like strategize and tell you how to do it. Like, I'm going to tell you how to do it, and then we're going to do it. So it's very, operational, make it happen, consolidation of a lot of factories. Also, I'm a human. So when you have to consolidate factories and unfortunately have to close some of them down, it's better that I'm fighting for those packages than somebody from a corporation who's not even tied to you. Like, I know these people, I've met them. We have to fight for the right things, and know that there's people's lives in your hands. And I think like you need to kind of think about that with a human touch. And so that was very much what I focused on. I was on the ground. So a lot of times, like, I would take the strategies that all these really big companies would kind of come up with and then say, okay, how are we going to do that? And then figure it out and do it. And that's, I thankfully got a great reputation of doing that. And then I started helping companies, and I started sitting on boards and getting advisory positions and things like that. And that's kind of how it snowballed into a lot of the corporate positions that I'm in now, such as the CEO of a healthcare company, a med tech company, like, because, startups and small companies need people to do. Those are the types of people who are, who have been entrepreneurs, are great people to hire for growing and building those types of companies.
And then Her Health EQ. I mean, it's such an interesting niche and concept. So what began as a donation of a mammogram machine to Costa Rican hospital has grown to an international web of healthcare solutions. So tell us about like how it began precisely, and if you think this model can actually scale throughout the world, and why.
So it started when I was working in corporate, and I developed the 3D mammography system, and the 2D systems were coming back. And so a friend of mine who lived in Costa Rica, where I was living at the time, said, there's women dying of breast cancer because their mammography machine broke down. Well, I knew against the factory wall, there were all these mammogram machines sitting there. So like, why wouldn't we just donate one of them? It was one of those, like, I'm an engineer, I see a problem and I fix it. So let's do that. And it's kind of perpetuated, and it helps me learn the process of getting equipment into a country and figuring out all the shipping and, logistics and, all of those things and the processes. And so it started from there. It was my idea. It was the idea that kind of took a few more years to create an actual company and organization. I don't think that the donate everything for free model is incredibly efficient. I think that things have changed in the last 5 or 10 years, especially in philanthropy, that needs to make it more sustainable. There are certain instances where donate, things for free, such as humanitarian or war support or, natural disasters, like those things, like that's absolutely donate for free without a charge, make it happen. These are immediate people's lives. When we're talking about secondary healthcare, when we're talking about cancer screenings, when we're talking about maternal health, when we're talking about heart disease, they're emergency, but they're not as emergency. They're not basic need to live. And so there's this model that's starting to exist and starting to come out of philanthropy where, you pay a very reduced fee so that you have a bit of ownership, because we all know that you get something for free. You're like, okay, great, whatever, no, who cares? you have, and same thing with medical equipment. And a lot of the times they're like, oh, okay, this is great. Thanks. Like, take the pictures. Everyone feels good. No, we want it used. We want to make sure that like it gets out in the system and everyone uses it. And, I'd like them to, use it until it breaks, until it has no more useful life. One of the things that we do at Her Health EQ is to make sure that there's service contracts, making sure that there's logistics support, that there's training support, because it's not effective and efficient to just send a piece of equipment to another country and say, like, good luck to you, good luck, figure it out. We feel great about ourselves, but like, you have no idea what to do with this. So we do all of that. And, there is a cost obviously associated to that. We need to support operations. I'm not independently wealthy yet. So, and we want to make sure that also like the healthcare systems that are there, they have money to spend. They don't have $250,000 to spend, but they have some, they have money to spend on certain things. And if we make it affordable and accessible to them, they don't care that it's the model before the most important, the newest one out there. They don't care if there's a little scratch on it. They don't care that the logo is from like old marketing logo as opposed to the newest one. They don't know, they don't care. And it's no offense to these big corporate, companies, which again, I used to be part of and I continue to work with, but there's a value that getting other countries these equipment to make their population healthier means that they're also going to be consumers of the newest equipment soon in the future. And so first of all, start off with goodwill, start off with, helping get the equipment there through us, like, via a donation, and then, moving into eventually the consumerism side of it. And we help give that bridge and the publicity and the introductions as needed to the healthcare systems that already see that this is working. And to prove to them like, oh, look at all these lives we just saved with cervical cancer screenings. Oh, our costs eventually get to go down because we caught breast cancer early. Oh, people get it. And it's more than just like a WHO report that's come out. It's in practice, in country, people that they can speak to that have these lived experiences.
How do you decide which country to pick or which organization to help?
So we have a web of different partners. We also try, we don't go to the highest tier because they don't need us. The Doctors Without Borders, the MSFs, like, they don't necessarily need us. Would love to partner with them, but we're too small for them. But we partner with mostly local organizations. So organizations that are running already programs there, but they need the equipment to either expand or to better do their jobs. And so those are the ones that we partner with. We do a very big intake survey to determine if they are able to support the work on a continuous basis. They're able to provide the metrics. They have the visibility and the access to the population to be able to do the work. A lot of times we work with, local clinics as well, who are already in the community and want to expand their services, or they're doing the job, but they just don't have the equipment to do it. So like they don't have a handheld ultrasound that can help them on maternal health. They're just doing it, with nothing. And so they want to get more advanced, and they're starting to see a lot more of a population, and they need the tools to be able to do that. So that's who we partner with. A lot of times it's also based on recommendations, through the network. I've been in the healthcare industry for almost 25 years. So, we just kind of ask around, and we also ask our other larger partners who maybe they've worked with in the past or who they might want to work with in the future. So sometimes there's actually like 3 or 4-way partnerships that are happening to move it forward.
How do you make money off this? What are the economics of the business?
Yeah, so we raise capital and obviously donations from the public and, eventually grants and things like that. So that's some of the economics. Because we're a nonprofit, we can either, A, get the equipment for free, or B, we, again, because of our nonprofit status, we're able to purchase it at cost. So already the economics have significantly come down. We have logistics partners at UPS Humanitarian who very much help us with the shipping. So that's really helpful. And then we have partnerships with other with other service organizations, either in country or we pay for a service contract. And same thing with training. Now that a lot of things are online, it's actually made it much more easy for training. But then again, we have local partnerships with distributors sometimes, and we will pay them to perform the training, perform any installation that needs to happen. So it's right now it's through through a lot of donations, a lot of partnerships, financial partnerships as well. We are also moving towards the revenue share opportunity. So we'll provide a piece of equipment and you charge, a certain amount for it per scan, per use or whatever. It starts with a 50-50 until you pay off the piece of equipment. Once you do, it's yours to use for the rest of its useful life. We'll continue to support as far as service and training and installation and things that need to happen. So there's that model. There's also we just pass on the costs. So if we have to purchase something for cost, we just pass on those costs so that it doesn't affect us, as far as, and that, again, this is this new model of philanthropy that is, yes, we're almost this intermediary of being able to, they're paying for the equipment just at a much more reduced rate because we have the nonprofit status here in the US and have the ability to obtain the equipment, which every small clinic does not have. They can't just call up, a big healthcare company and say, oh, I'd like a donation of an X-ray machine. They can't do that. I'm grateful that myself and my board and our team members are able to do that. So it makes it a little bit different and better. And that's how it happens. But, certainly anybody in any partnership would love to have it. And corporate partners are really our lifeblood as far as like making sure our operations continue.
You feel you could be more impactful as a for-profit / a social startup?
So yes, we've entertained that, and we actually have the model to be able to do both. And so that's where the revenue share opportunity comes in, so that, we could be that social impact model. That is probably where I'd like to go for us, probably in 5 years. It's still a very early model for the rest of the world, and everyone has to really get up on it. It's being pioneered very much in India, actually. And there's several organizations also and companies in Latin America and a few in Southeast Asia. But again, when we're talking about a handful, like maybe there's 10, there's that are doing very well, and continuing operations. There's a massively growing middle class throughout the world. The middle class wants to pay for quality healthcare. So for us, we see that as an opportunity. The healthcare systems themselves in these countries need to evolve into that, and they're only slowly starting to do that. It works very well for programs like in breast cancer screening, because there is a population who wants to pay for advancements in breast cancer screening. When we're talking about maternal health, there's a smaller population who are willing to pay a little bit more for for an ultrasound. For us, we think, handheld ultrasounds should just be standard of care. And that's very much what a lot of places feel like as well. And I think like as the healthcare systems evolve and adapt, as there's a growing middle class, this is where that model can start to evolve. And I think we have, it's growing, it's slowly happening. We're starting to get into it as well. But it's an evolving area. And I think for sure in the next 5-10 years, this is absolutely where all of the models want to go. And that's one of the reasons why we've actually created both divisions of our organization.
So what have been your top 3 challenges for 2023 yet, and how have you resolved these?
So first and foremost, for a nonprofit, it's always raising capital. So, and having enough donations and support to be able to do our programs. We can deploy hundreds of pieces of equipment in a year if we wanted to, and if we had the ability to. We just simply don't have the capital ability to be able to do that right now. So first and foremost, our challenges are, related to financial support and partners. There's been a lot of global unrest. So there's been changing priorities, obviously, on focusing on health in different areas. There's the Roe versus Wade, that's been overturned. A lot of focus went into maternal health and contraception, as opposed to some other areas. So the challenge of so many continuous crises happening at the same time, which I don't think we'll get away from, certainly not in the next year. Those have been the two. Really, those are our two big ones. Like, I don't have, like, we have great logistics partners. We're always looking for more, always looking for new corporate partners, always looking for, additional equipment to deploy. And that maybe that could be our third one. But that's, I think if we spent the time to focus on that one, we would definitely, have the opportunity to deploy more equipment.
So as a human being, what will be your main goals for next year?
Well, I am looking to sell DeepLook Medical and get acquired. So that's a massive goal towards the end of next year. So that's first and foremost. With relation to Her Health EQ, absolutely the deployment of at least 50 to 60 pieces of equipment in this next year. That alone will impact 500,000 women's lives. That's incredibly impactful. That is what I am really, really focused on. We need corporate and support to be able to do that. And those are absolutely our goals. And then, I'd actually like to take a vacation maybe once or twice. So a little bit of mental health and sanity is for sure a goal in 2024. Haven't had that much of it in 23. I had a little bit of it, but it feels like a distant memory from the summer. So that's a personal goal of mine.
Right. I'm guessing 16 plus hours a day you're crunching.
Yes, typically.
And how do you split your time?
It's not healthy.
Yeah, well, I mean,
it's not healthy on a continuous basis without the ability to shut down. So right. I understand it.
But you're doing it for a reason, right? Like it's not like all unhealthy when you're crunching work. We do it for a reason. It's complex calculus, and we may calculate up there that it might have a nice ROI over the future for full lifetime. So how do you split your time between the consulting, the business that you're seeking to sell, and that nonprofit, like in terms of percentage?
Yeah, so I'm not doing very much consulting at all right now, just because I'm a full-time CEO at both companies. So I split the time, unfortunately, for Her Health EQ. I split it about 80% with the DeepLook, 20% with Her Health EQ. I'm working to get a little bit more balance on that. I'm thankful for the team that we have at Her Health EQ to help support me as well as I'm working on that. But I split my time there. I also work nights, like you're saying, I work nights, I work weekends, I work, remote, I work wherever I am. I think exactly what you said. I'm doing this for a reason. I'm doing this to better and further women and women's health around the world. To me, it's a mission. It's what drives me when I get out of bed in the morning. It's what drives me when I'm staring at my computer at 10 o'clock at night. It's a drive. Is every day sunshine, unicorns, and rainbows? Absolutely not. But like, when I think about it, like, am I improving the health of women around the world? That's why I do it. And it's exactly what you said. There is an underlying mission that keeps moving it forward. And, I think also taking a break and spending time with friends and family and understanding, and celebrating the wins. I mean, we just won a very prestigious award last week. And like, I was able to celebrate that. And that's like, it was nice to be able to do that, to take a minute and to really recognize and think about the work that we've done, knowing that there's so much more to do in the future. But like, okay, well, great. Like we did a lot to get this, and we'll do more to get other awards and prestige. And so I don't know, it's there's no splitting. I don't believe in balance. I don't believe in splitting. I don't, you do what you can at that moment for what you need to handle. Like, sometimes it's DeepLook, sometimes it's Her Health EQ, sometimes I'm in Ghana, sometimes I'm in Boston or in New York. You do what you can at the moment.
How do you maintain that lifestyle? Do you have some habits that allow you to go hard for that long of an extended period?
I know I've been, I'm a little older in age, so I get to know where I'm about to hit my wall, and I will take a break. I also make sure that, like, I do work out, when I can. I go for walks. If, when the weather's nice, I take a few conference calls like outside on a walk. Like it's just mental balance. And that's, I think, what it is. I think it's also like knowing that there's milestones coming up and being able to hit them and move forward, and then taking some sort of break. And whether it's an actual physical break or it's just like a mental break or whatever it happens to be, maybe it's even just a weekend or spending time with, people, who are not associated with work. Maybe helping other people and realizing how blessed my life is, puts it in perspective where it's like, I have the ability to be able to do this. I'm very lucky to be able to do this. I'm blessed. So put that in perspective with everything else that's going on in the world. And that's kind of how I do a little recharge. I mean, I also sit on the couch and stream Netflix or Apple Plus, just like everybody else does. It's just, I sometimes don't do it all the time. It's, like that's my break.
Love it. Where can people find out more about you, Marissa?
For sure. So marissafayer.com or at herhealthyq.org. Those are the best places, or LinkedIn. I'm definitely very active on LinkedIn. So please reach out.
It was another CEOwisdompodcast.com with Marissa Fayer and Charles Cormier. You can find out more also about my podcasting agency at podfire.com.